Breast tenderness is a common symptom for many women, particularly around menstruation and pregnancy. But research is showing that for older women taking hormone replacement therapy, HRT, it could be linked to an increase in breast cancer and shouldn't be ignored.
We focused on breast tenderness because we felt that breast tenderness was something women could report easily to their clinicians, their physicians, and it was easy for them to notice. And it was a symptom that traditionally doctors really had ignored as more or less an annoying side effect of taking estrogen plus progestin menopause therapy. They sort of would reduce the dose or change to another pill and not really treat it as if potentially it could be a sign of something more ominous. It just seemed like women had no way of really knowing who was at a particular risk of getting breast cancer when they took estrogen and progestin therapy. We've never had a symptom before that we could track. And so that was the final reason I think that we could choose a symptom that actually would be obvious that women could track.
So while there are far fewer women on HRT during menopause than there used to be, there is still this risk of cancer, and it does worry them.
Absolutely, and just to be specific too, the risk really is only associated or most strongly associated with women who take a combination of estrogen and progestin therapy. Estrogen alone, especially in this Women's Health Initiative, this very large, reliable trial study, estrogen alone was not associated with a higher risk of breast cancer. In fact, it was a borderline, possible even reduction, but at least no increased risk.
So just to clarify, you have to have a combination therapy if you haven't had a hysterectomy, if you've still got a uterus. So you need the progesterone to counteract the estrogen, or there's a risk of cancer of the uterus. Whereas if you've had a hysterectomy, you can have estrogen on its own.
Correct, and you should, because there's no reason to risk an adverse effect from taking the progestin alone. So basically it is a trade-off. You're trading off the protection from uterine cancer if you add the progestin to your estrogen, with the increased potential for increased risk of breast cancer, albeit small, if you add the progestin to the estrogen therapy.
So this breast tenderness that women get on HRT, it's similar to the breast tenderness that women get on the oral contraceptive pill.
My suspicion would be yes. I don't think it's ever been studied in any sort of systematic, rigorous scientific way, but yes, breast tenderness is also a very common side effect of oral contraceptive therapy.
So what did you look at for this study?
The Women's Health Initiative was a study done in 10,000 women were selected to receive in a random way either a placebo pill, a sugar pill with no active medicine, or estrogen by itself. And then another 16,000 or so women in the Women's Health Initiative who still had a uterus. So they needed to take some progestin therapy if they were to take estrogen. They then were randomly sorted into either getting a placebo sugar pill or a combination of estrogen and progestin therapy. And what we did was look at approximately 5 or 6 years of follow-up of those women over time, and we looked to see whether the women who had a new onset of tenderness in the breast may be at a higher subsequent risk of getting breast cancer.
So the women didn't have a history of breast tenderness. It was linked to being on the HRT.
That's correct. Although we also were curious about women who had tenderness before they started. And in fact, the increase in the breast cancer risk that was associated with tenderness was especially pronounced if the women had baseline tenderness before they began the estrogen and progestin therapy.
So to what extent did tenderness at the beginning of HRT predict the risk of breast cancer?
The risk in women who had baseline breast tenderness who took the combination estrogen-progestin therapy, they had about a 2-fold increase in the relative risk of getting breast cancer. That is compared to women who didn't have any baseline tenderness. Whereas the women who didn't have any baseline tenderness, if they developed a new breast tenderness taking estrogen and progestin therapy, they had about a 33% higher risk of having subsequent breast cancer. That's a stark contrast to the women who were just taking estrogen alone, where tenderness was not associated at all with the future development of breast cancer.
So what's going on here?
Well, I think we have several parallel lines of investigation now, lines of scientific evidence that would say, look, the effects of estrogen compared to estrogen and progestin on the breast are just different. What the mechanism might be behind this is that estrogen by itself in the Women's Health Initiative did increase the tissue density on the breast on a mammogram a little bit, but not close to as much as the degree of increase in the tissue density that is seen with estrogen and progestin combined.
Breast density is where there's more gland tissue than fat tissue, and it's now known as a risk factor for breast cancer for a couple of reasons. Firstly, more gland tissue means there's more areas where cancer can develop, and secondly, when it forms in the gland tissue, it's harder to pick up with mammography. And the increased risk is significant. Professor Crandall says that women with the most dense breasts have a 5 to 7-fold increase in the risk of breast cancer. What you need to know, however, is that breast density isn't something you can tell yourself. It needs a mammogram and a doctor to determine it. Breast tenderness is not always associated with something being wrong. It's just something that shouldn't be ignored.